and a certified nutrition coach. I help moms locally in Las Vegas, Nevada, and all over the world shed the weight holding them back from becoming their most energetic and authentic version of themselves so they can go after their deepest desires alongside of motherhood. You can find me at fitandconfidentmoms.com. Hi, you guys. Welcome to our talk, Tuesday Talks inside our group, Fit and Confident Moms. I'm actually going live in a couple different places tonight. I have a special guest, Dr. Erica and Dr. Antoinette from White Wong PT. We're going live on YouTube. So if you're watching from YouTube, say hello, type live if you're watching the live, and type replay if you're watching replay. We're also going live on RP Fitness and Nutrition and Inside Fit and Confident Mom. So let us know in the comments where you're watching from, because we'd love to know when you are watching. So if you guys are new to me, my name is Coach Rose Peterson. I am founder of Fit and Confident Academy, and I help women lose the weight holding them back from showing up as their most energetic and authentic selves so they can keep going after their dreams alongside of motherhood. So we have these weekly guest expert talks because I don't know just everything. I like to advise people for their fitness, nutrition, mindset, but moms, women, we have so many goals, so many ambitions, and so many things that we want to improve our lives on. So once a month, I invite a guest into the group so that you guys can learn more from experts. And because we're in a big group of women, there's almost 400 people in this group. I know that some of you guys might want to learn more about your pelvic floor. We took a poll in the group about 2 months ago, asking you what are some topics that you might be interested as far as diastasis recti, learning more about strengthening your pelvic floor. And overwhelmingly, you guys wanted to hear about strengthening your pelvic floor. So I want to introduce Dr. Erica and Dr. Antoinette of White Wong PT. They're going to talk about your seminar, which is Adore Your Pelvic Floor. And I'm so thrilled to hear more about it. So I'll take it away, you guys, and let us know what you have for us.
Thank you, Coach Rose, and awesome to be here. That's quite the introduction, and we love it. And it's really awesome being able to be part of a group that supports other women, which is awesome.
Yeah.
So again, my name's Dr. Erica.
Hi, I'm Dr. Antoinette.
And we are part of a team of White Wong PT. We have a couple, I say 2.5 locations here in Las Vegas. We have one in Summerlin and then one in the southwest part of town. We started our clinic to have a better opportunity in healthcare. And we say healthcare because it's also health equals fitness equals wellness. So I say it starts there, and being able to have a better experience overall, because we don't want to be dictated by insurance companies. So that's like the main reason why we started, because I think you can get a lot of valuable information, and sometimes you just don't have the time to be able to do that. So with our practice, we have the ability to really dive into what you have going on and get to your goals of whatever that may be, whether that's working out without pain or even leaking, or just kind of feeling your body back after having a baby. That's so we kind of see a spectrum of people overall, but Antoinette is our pelvic health specialist. She treats men and women, but I'll let her introduce herself a little bit and then what we have going on for today.
Thanks, Dr. Erica, and thank you so much for having.
Oh, wait, you're muted. Let me unmute you maybe. Oh, I guess I have.
There we go.
There you go. Now I hear you.
There we go. Okay. So I'm a physical therapist and I specialize in pelvic health. So I do work quite a bit with the pelvic floor. I often work with women that are pregnant and postpartum. Doesn't have to be pregnant or postpartum, but oftentimes that's a period where pelvic floor or other orthopedic issues kind of show up, where women can really benefit from physical therapy. And kind of like what Rose was just speaking with us about, is that sometimes we're not always warned about pelvic floor dysfunction before it happens. We don't always know where we can look or if there is help for such a thing, but it's pretty common. And we kind of want to emphasize the fact that common does not mean it's something that you have to live with and expect. So there is physical therapy for this, and there's a lot to learn and a lot to practice with it. So I wanted to open just by asking everyone a question. Have you heard of Kegels, or is anyone interested in the Kegel exercise, or what might you know about that? You can go ahead and put it in the comments.
Okay, I just typed it in there too in case. Oh gosh, that's pretty cool. So it's typed in both the YouTube and on my business page. So I put that in there. Hopefully we get some questions. One of the things I wanted to kind of repeat what you said was that you don't have to live with this. So it's all like sometimes when I'm training females, it's like a joke that it's like, we always have to go to the bathroom, or we can't hold it long, or like this movement is going to make me pee. And it's like this joke of like, we have to accept this, but we don't have to. Like there is solutions. So that's exactly why I wanted to bring you on here, is that this is not like the lifelong sentence of things getting worse. Correct? What do you think?
Very, very important. So I will go into a little bit of detail today talking about sort of the muscular control when we're talking about things like urinary incontinence, which is a pelvic floor dysfunction, painful intercourse sometimes, which is pelvic floor dysfunction. It go to hip pain and things like that. So there is muscular control that we can use and that we can gain from our core muscles that we're going to talk a lot about today. So no, not something that you should have to live with. So Kegels are kind of like the pelvic floor exercise, the classic one where we feel where our pelvic floor is and we squeeze those muscles, which actually I'll show you right here today. The pelvic floor is kind of like a hammock on the bottom of the pelvis. So if we look at the back of your pelvis, this is where your tailbone, the very end of your spine is. Those muscles will attach at the tailbone. They'll kind of wrap forward on either side, going right to the front in the pubic bone. So I kind of talk a little bit about the pelvic floor almost as if it's a hammock of muscle that sits directly underneath our pelvis, just to give you an idea. So the Kegel exercise, or the pelvic floor contraction, I kind of prefer to call it, is when we take those pelvic floor muscles and we kind of just lift and squeeze forward and up to our head. It's those same muscles that you can think of where if you were sitting on the toilet and you were urinating and you just gently pulled up on those muscles to kind of stop that flow, that's exactly where the pelvic floor is. Also, if you were having intercourse or inserting a tampon or something like that and you just squeezed right around, that's exactly where those muscles are. So just to sort of introduce that as an exercise, I want to talk a little bit more about the anatomy of the pelvis as well. So the pelvis is made up of 3 bones. So you've got your pubis bones in the front, you've got your ilia bones, and then you've got your ischium, whereas that's the bone that you kind of sit on each side there. So these bones are connected by a couple of joints. You have your pubic symphysis in the front, and then if you're looking from the back, you have these 2 SI joints. The joints of the pelvis are a little bit different than a lot of our other joints, so they are pretty tight. They're not supposed to move a whole lot like joints of our elbow or knee would. So because of that, we also have a lot of ligaments around this area, which are kind of shown in this light blue color here. These joints are very rich in ligaments in order to keep this pelvic ring kind of a tight structure. The pelvis should work like a base toward the center of our body so that our core can kind of help maintain that closure of those joints and let other extremities pull off of them. Okay, so inside the pelvis, your organs would sit in here. So you would have in the front your bladder, your uterus slightly behind and on top of it, and then your rectum coming down in the back. So if I were to show you sort of the opening of the pelvis, this is sort of if you were looking straight head on at the bottom of a pelvis with somebody laying on their back right here, you can see that there's a couple of holes. So this would be the anus here. If you come up a little bit forward, this would be the vagina here, and then the urethra smaller, but toward the front more. So those passageways have to travel directly through the pelvic floor. And you can see that some of these smaller muscles here are circular right around those openings. So those are part of the pelvic floor. Your whole pelvic floor, all the layers together, should squeeze up and forward kind of toward your head and toward that pubic bone. So your organs inside of the pelvis, they're supported also by ligaments inside there, and they're also supported by muscle and soft tissue, in addition to that hammock that holds everything together from underneath. So I want to start by instructing the viewers of a couple contractions of our deep core. So those are some muscles that are really important to work with the pelvic floor in helping to prevent those pelvic floor dysfunctions. So I'm going to start with showing you a muscle called the transverse abdominis, and I'm going to stand up and move.
So I get the camera set up here, but we do generally, when we do our Adore Your Core, we have a little bit more interaction, but this is totally fine. So I want everybody also to participate with us. If you're watching a replay or if you're watching live, we would love to have you lie down on the ground, and Antoinette's going to go through the process and the exercises. But just pretend
I'm going to try to remove me so that you guys have the me.
Okay, I think we're still here, and I'm just going to unplug a couple things, but we'll make sure that we have this here. So bear with us here. And then we have Antoinette here.
I'm going to show my body. You can actually keep it here.
Keep it here?
Yeah, for just a second.
Okay.
All right, so I'm going to introduce the transverse abdominis muscle. It's one of the very deepest muscles of our core, and it works very closely with the pelvic floor. So the muscle on each side starts kind of toward our back, and it connects to our deep connective tissue, wraps around on both sides, deep like a corset, and connects right in the middle here. So if you can imagine, I was wearing sort of a brace or a deep corset all around my midsection here with fibers running across. That is called your transverse abdominis. So I'm going to teach you how to palpate that, and I'm going to get down and lay on the floor. This is kind of the easiest position to find that muscle in. All right, so if you take your fingers from each hand and kind of put them where your two hip bones right in the front stick out the most prominently, okay? That's called your ASIS. You can come 1 inch in and 1 inch down. And now you want to palpate just very gently, so kind of like a flat palpation. You don't want to be too pokey with it. You probably won't be able to feel it. So gently just kind of put your fingers there, 1 inch in and 1 inch down from that bone. Now, very gently, they say it takes about 20% of effort to engage your transverse abdominis muscle and isolate it from some of the bigger muscles around your abdomen. Gently draw in that lower abdomen, kind of like you're taking your belly button and pulling it toward the floor. And you can tell I'm still talking, I'm still breathing, I'm not pushing out, I'm not closing my throat and holding my breath. You should be able to just gently pull your lower abdomen towards your spine without any movement or without any kind of rocking of the pelvis there. Okay, if there are any questions, just go ahead and put them in the comments, and I'll try to help as we go and keep track of those. Okay, so that's your transverse abdominis. When this muscle fires, it should draw in and the pelvic floor should go up with it. So those two really work together in synchrony. So oftentimes when someone's got a pelvic floor dysfunction going on, I'll take a look at this muscle first. The next muscle I want to focus on is our respiratory diaphragm muscle. So that one's kind of seated almost like an umbrella sort of at the bottom of our rib cage here. So I want you to go ahead and put your fingers just right at the top of your belly and your lower ribs. If you can inhale deep through the nose, thinking of inhaling right into where this hand is and letting the ribs expand outward and then out through the mouth. That's your diaphragm muscle. So go ahead and do a couple deep breaths, feeling the movement of that muscle. Now, while you're working on the diaphragm muscle from the ribs, I want you to think about this spot right here on the pelvic floor. It's called your perineum. So if you can think of this area right behind your vagina and right in front of your anus, the hammock of the pelvic floor should work synchronously with the diaphragm, our respiratory diaphragm here. So if I've got my hammock on bottom and my respiratory diaphragm on top, with every inhale, those ribs should expand and the respiratory diaphragm should come down. The pelvic diaphragm should also move kind of down and out, sort of toward our feet as we do a deep inhale, and then gently recoiling back up towards our head as we exhale. So while you're working on that diaphragmatic breathing, try and think about this spot right here, the perineum. Think about that pelvic floor hammock and see if you can feel it moving downward on your inhale and very gently on its own, just recoiling up for the exhale.
We okay on sound, everybody? If anybody can reply back, but just making sure that everybody can hear us okay and see us as well.
Okay, so something important is that we talked a lot right there about the pelvic floor descending with the diaphragm. That's an important piece of pelvic floor relaxation. The pelvic floor and that hammock need to be able to come down and relax with the diaphragm. That's pelvic floor relaxation. A pelvic floor that is not able to relax all the way is not going to get a good contraction. So that relaxation piece often has to come first. That's really important. And sometimes that relaxation is not there if that muscle is holding tension. And in that case, Kegels alone would not resolve pelvic floor issues. So it can be really important to check out that relaxation piece first and make sure that the pelvic floor is moving well and it has good excursion before we really think about strengthening. Okay, so next I want you to lay on your back again, same position as we were in before. Now that we've covered pelvic floor relaxation, now we can try some pelvic floor contractions or Kegel exercises. So I want you to take your pelvic floor, and again, you can use that same spot, the perineum, as your point of reference there. And I want you to gently contract that pelvic floor up towards your head as if you're stopping the flow of urine, and then relax it back down. And I want you to do these fast, kind of like a light switch if you can. Just squeeze, release, squeeze, release, squeeze, release. Don't worry about any maximum holds just yet. And see if you can feel that layer of tissue coming up towards your head and relaxing back down. Make sure it relaxes in between fully. The next thing you can do after you feel that pelvic floor moving as you do those Kegel exercises is I want you to take your hands again, palpate that transverse abdominis just like we did last time. So feel where your hip bones stick out the most in front, 1 inch in, 1 inch down. And now what I'm doing is I'm just doing some of those quick pelvic floor contractions up and down. Again, you can tell I'm not holding my breath. What I'm feeling for here is I'm trying to see if my transverse abdominis is firing with my pelvic floor. You should feel that. So when the transverse abdominis fires, it's going to feel like a very, very gentle tightening or maybe like a little bit of pressure right under those fingers right there. So when you contract your pelvic floor, you should feel your transverse abdominis working with it because those guys need to work together. So those are just a couple of starting points that I work with somebody on the first day that they come to pelvic health physical therapy. And we can move back up. Thank you.
Bear with us real quick. We're just going to get reset up here.
Okay, so I'm trying a different little layout here that's a little wider. Let me try one other thing to see if it's different. Nope, that's the same. Yeah, so this one at least gives us a little bit of a wider screen. I can see both of you guys, even though it cuts off the bottom and top. So what if you have a hard time feeling the relaxed part, like telling the difference between whether you like really relaxed and feel that length, and then feeling the lengthening of what you were saying, how like breathing in, I think you said the perineum comes in or comes up.
So it should actually, as you breathe in and your respiratory diaphragm comes down, your pelvic diaphragm should also come down. So those pelvic floor muscles and your respiratory diaphragm kind of towards your feet as you inhale, and then they both gently kind of recoil back up on the exhale. So that's a really good question, and a lot of people do have trouble with that, especially feeling if the pelvic floor is able to drop or relax. So there's a couple different ways. If I were in clinic with someone, we could vary positions. But an exercise that I really like to give people on the first day to help with that is if you were to take a little hand towel or a small towel and sort of roll it up like the long way. If you're able to sit on it, like in a chair or on, probably not a couch, probably a little bit harder of a surface like a chair. If you're able to sit on it sort of the long way. Oh, cool. Erica's got a little towel here. Perfect. So if I were using this towel here, I'd probably fold it in half. I'm going to roll it tight. Okay. And then I would just kind of put it underneath me and sit on it the long way. So that would look like from front to back. Okay. So then thinking about this spot again, the perineum right between vagina and anus, you can try and feel the pressure from this towel just going right up into that tissue sort of, and that helps with being able to feel where those muscles are, and it kind of helps with being able to feel the tissue drop back down each time. So this helps a lot of people. I highly recommend it if you're not sure where the muscles are or if they're able to relax. It's a really great one. That and continuing with the diaphragmatic breathing.
So that kind of gives a little bit of feedback to whether that's happening.
Exactly. Yep.
Okay, cool.
Okay.
I have one more question. So what's the benefit of practicing the diaphragmatic breathing? Is it just for awareness, or what's the benefit of doing that?
So awareness is a piece of it for a lot of people. Also just range of motion, getting that pelvic floor to move because it needs to have good excursion. So our pelvic floor, it should always sort of hold a little bit of tone. We always want it on, and it should be able to contract when we need it, contract forward and up. But if it's not relaxing all the way, it doesn't have very far to go to contract, and it's not going to be effective either. So truly it needs to be able to relax and contract. It needs that range of the muscle. So I would say relaxation for most people is more important to get first. So that's a big part of the reason why just Kegels alone or only Kegels for things usually doesn't work, and sometimes it can make it worse. If you're having more of a letting go issue, it's not always the best place to start, even though it can be an important piece of rehab.
Yeah, I like that because I think there's a lot of education and a lot of people that say like you should be doing your Kegels, especially after you have a baby. They say that you should be practicing these often. And you're the first person I've ever heard of that says to feel into that relaxed part and kind of explaining how that there needs to be that, what was the word that you use, so that you can feel the like the lengthening and then returning back to its position.
Proprioception, is that the word? Be able to feel those muscles relax and move.
You just said it, and I don't know what it was. But anyway, I've just never heard of like someone articulate the importance of feeling that relaxed portion too.
Yeah, that can be a big piece, especially if there's pain. If somebody's ever having painful intercourse, or maybe they have issues with scarring or endometriosis or something like that, where our tissues are caused to hold tension, sometimes the relaxation is the piece we need.
I'll add to that fertility as well as with that, what she mentioned with abdominal consideration. So wound up tissue can be a thing. I'd say diaphragmatic breathing is probably a whole nother 2 2 to 4 hours if we really want to dive into it, because
Yeah.
it's so intricate, but it can also be super simplified. And that's actually where we typically start with people is how do people breathe and identifying which portions of the breathing pattern that we can optimize.
Yeah, totally. Okay. Very interesting.
Yeah,
Um,
another sort of fun fact too about breathing. If we are exercising or lifting heavy loads and we're kind of pushing downward instead of breathing, we're just sort of holding our breath and locking our pressure down on top of that pelvic floor. That can change how the pelvic floor recruits. It can over time, it can cause injury to the pelvic floor. So breathing is just very, very closely related to the deep core and the pelvic floor. But
so
that's a whole thing.
and maybe Dr. Erica could probably, I know this is going to be like, I'm trying not to go that way with the breathing, but when we're lifting heavy, we do like practice breathing and bracing. And so there is intra-abdominal pressure that we practice. So would having some moments of time to practice that deep breathing, will that help like improve the situation where it's not like kind of like unwind from that pressure?
Oh,
Does that make
absolutely.
sense?
Yeah. And I'd say to explain that the best is having a range of motion that you can control and that you've actually experienced. Because if there's stress involved or there's something that your body has never been into, it's never going to find that position for you. So if you've never practiced and this is our rib cage as we think about it, if we've never been able to open it up all the way, your body's never going to use that as a default. If something were to happen or, there's an emergency or whatever that may be, it's just going to be like, this is all I know. So if you never, I use it as an example. If you've never been to your friend's house before and your friend just moved and you've never been to an area and you're like, oh, like, I don't know the streets. I don't know what restaurants are around there. You generally are just focused on getting to the place. But after a while, you get used to it. You're like, oh, like I know that there's a McDonald's on the corner. There's a gas station. There's a Crumble Cookies. There's all those things that you can identify because you've been there before and you're familiar with the situation. I'd say that's the same way our brain works is we're familiar with it, so you can actually access it when you need to.
Okay. So then, so then the practicing the breathing part because like Dr. Antoinette was saying, oh yeah, don't worry, we're going to talk about that. Somebody wanted to make sure that we discussed about it's Linda actually. Hi, Linda. The Emsella, or even if it's not Emsella, and you can address this when it makes sense in your talk, but about devices that help with improving pelvic floor symptoms.
Okay, so with the Emsella, I'm not as familiar with Emsella as I am with eStim. I haven't been taught about that in any of my courses. But generally, it depends on somebody's strength that they have. So, as a pelvic floor therapist, I'll go in internally and I'll check out those muscles for strength, endurance, range of motion, all of that. So, if somebody's got 2 out of 5 strength or greater, just based on how we as therapists grade it, usually I like to just put them in different positions and strengthen them that way over time. We usually consider that someone might need some sort of device to facilitate if they have more of a 1 out of 5 strength. And that's usually somebody that cannot feel the contraction very much. Maybe they had some nerve stretching or some nerve injury during labor and delivery. Sometimes that's those people. It doesn't tend to be most people. But again, specifically on the Emsella, I'm not that familiar with it.
Yeah, and then we can also get back to you on what that actually does, because sometimes we'll get a name brand device and we're not familiar with what technology is used. And it's usually when it's advertised on websites, it doesn't give you what technology is being used. So once we find out what type of technology is being used, then we can give you a better answer. But for now, we'll get back to you on what's actually occurring in that type of treatment.
So, but you did mention e-stim. What is that exactly?
So it's electrical stimulation. So sometimes they use it in regular physical therapy too to help recruit muscles that maybe have been injured or just had a surgery to them, to kind of get those muscles to fire back up again so that you can strengthen them and do functional activities with them. The pelvic floor is the same. So if there's some sort of injury or procedure that was done and maybe your pelvic floor is just not turning on or recruiting, that's when I would recommend the person to get an internal sensor. That's what we call it. And it's sort of a device that you stick in, and then we attach it to an external device and we set the parameters depending on what the person needs. And it helps to turn those muscles on and off. So there might be an on time and an off time where I say, okay, 1, 2, 3, squeeze with the device as we try to wake those muscles back up. That would be e-stim.
Interesting. Okay. And typically you would only use those for patients that have that, like you're saying, on that 1 to 5 scale.
Yeah, 1 out of 5 strength. So typically trouble turning the muscles on, trouble recruiting them completely. If they have more strength than that, I'll usually move more to functional positions. Kind of say, what do you do for work? Or what is your sport? Or where are your symptoms happening that's bothering you? Just keeping in mind that most people's problem is not um, the inability to squeeze. It's what happens when I do my activities. Why does this happen when I try to do this or bend down or jump or something like that?
Absolutely. Okay. And you're right. It's during those activities of daily living and exercising that we're having these issues, not necessarily like when we're laying down, right? Is that what you're
Mhm.
saying?
Yeah,
Yeah.
exactly.
Okay. So it's like better to get those functional positioning. There's more benefits to doing that, you think?
Yeah, basically, if you're able to work there, that's where I would push you to work. But just depends. Everybody might be starting in a different place. The table's a great place to start for sure to find things.
Very cool. So what else do you have for us?
Okay, so I wanted to talk about urinary incontinence because that is a super, super common pelvic floor dysfunction. There are a couple different types of incontinence, so I just wanted to touch on that a little bit. There is stress urinary incontinence, which would be urinary leakage when we have an increase in intra-abdominal pressure or when we're taking force or impact. So that would be the type of thing where you don't necessarily feel your bladder's full, but maybe then you run and each step you take, you feel like some fluids leaking, or if you cough, laugh, or sneeze and it just comes out, that would all be stress urinary incontinence. Urge urinary incontinence is probably the next common one that I see. And that one is more where people have the tendency to feel no urgency of their bladder and then suddenly very strong urgency, like they've got to run to the bathroom or they might lose it. So if someone's having urge urinary incontinence, their complaint will usually be more like, I lose it on the way to the bathroom. I can't hold it as I'm walking to go empty. Sometimes people have mixed urinary incontinence, which is a little combination of both. Today, I'm going to focus a little bit more on stress urinary incontinence. And I wanted to know, does anyone know a little bit about how the pelvic floor or how our deep core muscles can work to prevent stress urinary incontinence?
So I did not even know that I know this sounds like probably silly, but I didn't know the pelvic floor helps with that. I honestly thought, like, everyone says like, well, we have a weak bladder, or like my bladder
Mhm.
got, you think about 9 months, I had a baby sit on my bladder for 9 months. So now my bladder is ruined. And that's kind of like how people think of it, but they don't really think of like strengthening the pelvic floor muscle.
Mhm. It's true that during pregnancy, the weight of the fetus kind of contributes to that pressure on the bladder, sure. But pregnancy itself, in a normal situation, shouldn't be expected to really damage the bladder. The pelvic floor might be a little bit affected. Some of the muscles and ligaments in the area, which I'm going to talk quite a bit about, they can be affected by pregnancy due to hormonal changes. But in terms of weak bladder, kind of that's more of like a like maybe a misnomer or like
Yeah.
a slang term. Overactive bladder is a diagnosis where the muscle that surrounds your bladder gets very triggered to contract, and that causes you to frequently be going to the bathroom and sometimes have that urgency. So, yes, but the muscles underneath the pelvic floor, or sorry, the muscles of the pelvic floor that are underneath the bladder, they have to support the urethra. So, kind of what we pointed out, that tiny hole, you might not be able to see it on there, but tiny hole in the front, that's your urethra. So, the pelvic floor muscles, when they squeeze forward and up, the urethra should get kinked just enough by the pelvic floor and transverse abdominis reacting to pressure, and that should prevent that urine from leaking through. There can be
Okay.
a lot more that goes into that, sometimes depending on things like your hips and things like how your other muscles of your core are firing. But that's your deep core's job, is to anticipate pressure and changes in pressure, changes in load, that kind of thing. So I wanted to just talk about when we want those muscles to engage, which I hit on a little bit, but we practiced on our back voluntarily contracting the pelvic floor and seeing if the transverse abdominis goes with it. You need those two to contract together. You should be able to feel them. You need them to contract when we have changes in load. So that could be like when you pick up something heavy, or with each rep that you're doing at the gym, or if you are, yeah, that would be like if you pick up something heavy or you're moving something heavy using your extremities. And then also with changes in intra-abdominal pressure. So coughing, laughing, sneezing. Basically, it's the deep core's job to anticipate our movements and our loads. So, by those muscles contracting just before we move, or just before we jump, or just before we sneeze, they put a little bit of tension on those deep tissue layers just to kink that urethra. Doesn't need to be anything maximal, it just needs to happen at the right time and happen together, and also have really good endurance. So those pelvic floor muscles and transverse abdominis muscles, they're the type 1, the slow twitch fibers. So they focus a lot on endurance. We need them on a little bit all the time. They need to be able to contract and sort of pick up a little bit more when we do activities that need them. So I kind of wanted to just emphasize there that incontinence does not always equal weakness. And that's another sort of popular misconception, is that if there's any leakage, it's because things are weak. So I need to squeeze more often or squeeze more hard. And like I said, if you're not getting that relaxation, you're not getting that excursion of the pelvic floor, that might not be what you need. It might, in fact, be the opposite.
Totally. This is really interesting. And if you guys are learning anything new, any aha moments, drop them in the comments. If something that you heard was like, wow, I never thought of it that way. Would love to know what resonates with you. If you have questions about anything that Dr. Antoinette is saying, drop them in the comments so we can go over them. Because if you're thinking about it, somebody else watching is probably thinking the same thing. So don't be afraid to drop in the comments or share your story if you struggle with something, and then let us know, because then maybe Dr. Antoinette might have a tip for you. But yeah, so what else? Is there something else that you're gonna jump into?
Yeah. So after covering that, just kind of that strength is usually it's not the biggest issue causing incontinence. If it's that stress urinary incontinence, it's often a lack of endurance, or it contracts at the wrong time. So say that you sneeze and then your pelvic floor contracts after, it's kind of too late. It's not really going to do its job. Or if you jump off a box and your pelvic floor doesn't really kick on at the right time, then it's not going to do its job either. So the timing is really important. The endurance is really important. If you're somebody that's going to be doing long distance running and those muscles kind of get tired and start acting weak after 10 minutes, that they're not going to do their job. So endurance is really huge. So as a physical therapist, I'll look externally, just like all orthopedic physical therapists will, at the hips and the back and the muscles of the thighs, muscles of the core, and all that. And then I'll do an internal muscle assessment of the pelvic floor and some of the hips. So with that, I am looking for strength to get that strength score we were talking about, but I'm also looking for endurance, coordination, their ability to contract with the transverse abdominis. I'll have you sort of cough for me and see if that muscle's contracting upward when you cough. So trying to get a little bit of an idea for what might be going on and why during your activity.
That's really cool that you go over all, like, not just, the pelvic floor, but if all the other muscles are working together properly and seeing what's not being supported. That's really cool. And I think a lot of people don't realize how connected your core muscles are and how your hips are related to that as well. We have someone who's asking a question that said, anything to help during pregnancy. I definitely have to cross my legs when I sneeze, LOL.
Sure. So those muscles on the inside of your legs, the adductor muscle group, they actually connect by soft tissue up toward the pelvic floor. So you might be trying to gain a little bit of tension on those muscles on the inside of your thigh to kind of pull and in a way contract your pelvic floor indirectly there. I would recommend not doing that if you can. The reason being because we can teach those muscles there to hold tone, to kind of hold like a neurological tension, and we don't want to try and do that. During pregnancy, usually if you go to physical therapy, you probably won't get the internal exam, but there are exercises that you can do. You can get an external pelvic floor muscle exam. You can also work on muscles of the hips and core. So I'm going to talk quite a bit about pregnancy. During pregnancy, your body's going to be changing a little bit each week. So while it might kind of become a management thing where we learn how to prevent that incontinence for as long as we can and as often as we can, your body will still be changing and, until you deliver. But a tip that I could give you, just a quick tip, is called the knack maneuver. And it's something that should hopefully happen voluntarily, but sometimes we can use it to help block that incontinence. So if you feel yourself about to cough, laugh, or sneeze, what you can actually do is do that little Kegel, that pelvic floor contraction, pull those muscles up and forward a little bit, just around that urethra, like you're stopping your flow, and then go ahead and do your sneeze and then let the pelvic floor go. So don't hold your breath or anything like that, but contract pelvic floor and kind of like brace your cough or your sneeze. That might be something to help you in the short term to leak less, or hopefully not leak.
Also, nothing's too TMI because this is what we want to talk about. So ask any question you can and want to ask, because we want to make sure that people are aware that these things exist and that you don't have to live with it. So please just ask us anything, really.
Yeah. Yep. We love it.
That's interesting. Have you heard about, and I guess I never even thought of it this way, about the crossing the legs and like trying to recruit your adductors to help with the pelvic floor. Is that a common one that like women will do, is they'll try to use their legs instead of
yes.
Okay.
And I find it kind of more common. I know that the user that asked that said they're during pregnancy, so this might not apply to them, but usually when I meet people that chronically for years will be like, I always cross my legs, I always push my knees together. I've had this problem going on for a very long time. Oftentimes I will find more of that urgency being a problem. Rather than just the stress incontinence. A lot of the time I'll go in and palpate that pelvic floor and it might be tight and tender, or they might say like, I go to the bathroom pretty often and I'm always having to run there, and they'll kind of have a story like that. So in our courses, they instruct us to kind of try to persuade people away from the squeezing the legs together.
Okay. Because that would just lead to not using our pelvic floor the way it's meant to be used, and then just prolonging the problem longer.
Kind of straining the pelvic floor too, just like the Valsalva maneuver strains the pelvic floor. So something that they also taught me in my class too, because of that same reason, was the machine at the gym, you know, the one where you squeeze your knees together.
Oh, mm-hmm.
It's
Yeah.
like not our favorite adductor exercise for the pelvic floor.
Ah, okay.
Yeah.
And to add to that, it should be a normal response, like an automatic response. So we want to make sure that we can recreate an automatic response as best as we can, so we don't have to think about it.
Right.
That takes a lot of practice to make it an automatic response.
Yes. And also just considering the connective tissue and the soft tissue that connects to muscles of our core and our lats and our pelvic floor and those adductors, everything is all connected. So what we want to do ideally is work on exercises that put tension through that whole system together. Get your core working while you're doing some functional movements, depending on what your job is and things like that. We want to teach your muscles to build tension together while your core is on, while your core is firing.
So, quick question. You mentioned about making sure that your hips are strong. How does that play, having hip strength or making sure checking the muscles around the hips? How does that play into healthy pelvic floor function?
Sure. So sometimes the rotator muscles of the hips, they can be involved if there's pelvic floor dysfunction. There's a muscle, your obturator internus, right on the inside. You can kind of see there.
Okay.
I'm trying to angle that, sorry. And it attaches right to your pelvic floor on either side. So that would be a muscle that lets
Sorry about that. You can
It's
hear
okay.
us?
We got you now. Yep.
Okay, sorry.
That's okay. So your obturator internus muscle connects to the pelvic floor on either side, and it would be the muscle that kind of lets your hip turn outward. So if you pictured your knees and your legs kind of angling out, that would be that muscle. You can kind of think of the pelvic floor a little bit like a trampoline. So if the pelvic floor muscles, the ones that go from the tailbone and wrap underneath right to the front to the pubic bone,
Mm-hmm.
think of that as the black part of the trampoline. Oh, sorry. That has a little bit of a give and a little bit of elasticity. Well, the muscles of the hip rotators, they would be kind of like the springs on the trampoline. So
Okay.
if those muscles are really tight or they're holding a lot of that tone like they can't let go, that might affect how the pelvic floor can relax and how it can move and sort of that give that it has. And if those muscles are weak and they're not really firing, then your pelvic floor doesn't really have something great to pull off of. So,
Okay.
yeah,
Actually, that makes a lot of sense.
yeah.
And to add to that too, we look at a lot of position stuff. So if you can't get into a position, then those muscles can't be optimized to fire in the best of ability. So that's usually what we look at are those muscles so tight that we can't get into a position, which is most of the case is what we see. Is like not a lot of people are not strong or like you need to strengthen things. It's actually we need to get in positions that you can actually tolerate, and then you can actually kind of restore that automatic function, if you will. And that doesn't necessarily mean in the pelvic floor. We see it so often too in our hips and backs and shoulders is we people don't have the positions to get into certain positions. Therefore, they're having trouble, and it appears that they're weak. It's that their muscles can't get into the position.
Can you explain that positioning a little bit more? Like what position is optimal, or what, like for like me and you, like we can understand that, but for like most people, like what are optimal positions? What are they looking for?
So it depends on what body part in general for us. We have like a typical positions that we need to hit. From our screen that we would do, it would be really dependent on the body part. But to give you an idea is if your bicep, let's see, biceps so tight and you can't move past this position, right? If that's like your bicep is just preventing you from doing that, this is all you have. So if you needed to get into this position, you'd have to fight the bicep. same thing, you wouldn't allow it to straighten out. So if the front side of the bicep is so tight, then the tricep can't actually be used because you can't actually straighten it out. So we see that a lot of times in hip dysfunction too, is the hip flexor or the front of the thigh is so stiff that you can't access your glutes in a sense, because the front of your thigh is so tight that you can't get your hip backwards. And you see that commonly is people will do this. So in order to get a position, or say if my shoulder's so tight that this is the furthest I can go. The other way I can do that is to arch my back, right? And it looks like I'm overhead. That's one way that you can do it. Or that you're just going to jam it as best as you can. So it's really like, it's simple. It's like there's only two ways that your body's going to do that. You're either going to arch it, or you're going to essentially do it from some other position. So that's generally what we see is, can we restore a position for somebody? And then it makes it easier to actually recruit those muscles, like Antoinette was saying, for endurance.
I see. So not just the strength, but also, there was a word that I thought of when you're talking is, there's that balance and symmetry that needs to be in play for all sides of the position, where we're also trying to unlearn compensations. That's the word I was looking for. So we also might have to unlearn compensations that we might be doing, just like you were saying with, like Brittany mentioned about crossing her legs. That's kind of a compensation for what she wants to do. Is that correct? Or what her body should be doing?
Yeah. Another one would be like if somebody has hip pain, or they've had hip pain for a while in certain muscles, and a little bit of an imbalance from left to right. So I talked a little bit about these joints in the pelvis. They don't move a whole lot, but if you have muscles that connect, like the hip flexors, and they're sort of pulling the pelvis in one direction, well, your pelvis is going to be a little bit asymmetrical left to right. So when I go in internally, I can sometimes feel that, like, oh, the left side of your pelvic floor is up higher than the right side is. So sometimes just that asymmetry in itself can contribute to incontinence. And so we've got to check out what's going on with the back. Why is something pulling somewhere? Which side is not supposed to be pulling like this?
That's really interesting. And that's what's really valuable about having an exam, is really finding out what the root cause is. Because like you're saying, there's multiple, not just the pelvic floor, and not just maybe an overactive bladder. There could be multiple reasons that this is happening. And so being able to see experts like you guys, you're able to kind of examine someone to see where the main issue could be, or maybe there's a lot of small things that they could work on. Is that correct?
Yeah, that's the goal there, trying to sort of tease out which musculoskeletal parts of this might be contributing.
Very cool. All right. Well, this has been super interesting. Was there another portion of this that you wanted to go over before we wrapped up?
Yeah, and I'll be kind of brief about it because we've been bouncing around. We touched on it a little bit, but I just wanted to briefly mention pregnancy and postpartum. So I know that that's a time where a lot of pelvic floor dysfunction comes up that might not have been present before. The reason for that is ligaments of the pelvis and abdominal region respond to hormonal changes very sensitively. So during pregnancy, we have about 30 times more estrogen going on in our body than we do pre-pregnancy. And we think that that's kind of one of the big key hormones that causes our ligaments to kind of become lax. So this tight pull that they put across all of our pelvic joints to kind of keep this pelvic bowl tight together, it kind of relaxes up. So although that's only a very subtle difference in millimeters with these pelvic joints, a little bit of asymmetry can cause a lot of pain. And also it kind of causes your muscles to have to do more. So in order to get the same things done, like maintain continence and not leak, we're asking our deep core muscles to fire maybe a little bit more, and we're asking that while they're being stretched by the weight of a fetus. every week a little bit more. So those are normal changes that we expect to have a good, healthy pregnancy and make room for things and everything. But sometimes for being able to do the things that you love to do, sometimes it just requires a little bit of attention to kind of figure out, why is this happening? Is there something we can do to kind of make this pregnancy easier? Or if you want to work through your pregnancy, or if there's a sport you want to do during pregnancy, is there a way that we can find to keep you doing this successfully for as long as we can, kind of thing. So basically, some take homes would be that the pelvis requires support, stability, and the ability to produce some tension to help us prevent musculoskeletal pain, incontinence, pelvic organ prolapse. Does anybody know what that is, maybe?
Oops, sorry. I was going to type it into my phone to see if anybody, I was going to type it in here because for some reason it comes over faster through my phone.
Oh, okay. Well, I can start going over
Yeah.
it. A pelvic organ prolapse, that would be when one of our pelvic organs, so our bladder, our uterus, or our rectum, can be pushing toward the vaginal opening or sometimes the rectal opening. It doesn't necessarily mean that it has to be hanging out. So sometimes people get really afraid that, like, oh, it means my body's falling out of me. Not necessarily, but the weight of that organ is kind of starting to come toward the opening because we have less support there. So that's just something that can sort of happen with pregnancy, labor, postpartum, constipation. So that's another thing that can be improved with pelvic physical therapy, seeing what are the musculoskeletal components of that and why it's happening. Diastasis rectus is another big one, especially postpartum. So that one is if we think of the two rectus muscles, rectus abdominis, those six-pack muscles that come straight down through our torso. During pregnancy, that deep transverse abdominis, it's changing in size every week. It's kind of expanding. And if it's not firing well, sometimes there will be a little bit of an opening between that rectus muscle. So that's where you get that little bit of a dip, sort of, if you were to put your fingers in, that a lot of women complain of at the midline after postpartum. That might be a little bit normal during pregnancy as things are stretching, just to keep a good natural tension there. But then postpartum, we need to retrain that in order to have people move comfortably. That can be really common. It can contribute to other things down the line, just like everything can that we've talked about tonight. So that's another condition that's good to see pelvic floor physical therapy. Basically, with pregnancy and postpartum, your ligaments will change length because that's what they're supposed to do, and your muscles may too, but muscles are voluntary. So the good news about muscles is that we can do a little bit of work and relearn and kind of build endurance and get things to work better the way we need to, although not everything's going to feel the same as it was before pregnancy. Ligaments are not going to change and go back. What's common is not necessarily normal. So just because maybe if you're having issues with leaking or incontinence and hear that your friend that does the same sport is too, that doesn't mean, oh, it happens to everyone, so we all should just know that we're going to leak. Doesn't have to be that way. And my goal in PT is to pretty much just find those things that are contributing musculoskeletal and see what we can work on, do some homework, do some techniques to just improve how your functioning is.
I love that. So you mentioned a little bit earlier about external exams for pregnancy. So can a woman who's pregnant come and see you now, or do they need to wait until after their pregnancy?
They can absolutely see me now. I've never done an internal exam on a pregnant woman. I probably wouldn't unless their doctor specifically wanted that. But usually I will do a good thorough screen of their back, their hips, their core. We'll do a lot of core work during pregnancy because your core muscles are changing so much. And if there's incontinence, like they complain about something that seems pretty related to their pelvic floor, we can always I can do an external exam. So if I had them lay on the table kind of like this in this position here, there are ways with a gloved hand that I can kind of palpate the deep part of the pelvic floor if they're wearing yoga pants or underwear or something like that. Or I can also palpate these more superficial muscles. So I still get some information on the pelvic floor and how it's functioning for sure. Might not be quite as in detail as I would get internal, but still very helpful.
Well, very cool. So if anyone in this group wanted to see you guys or get help, I know that you have a special offer just for the ladies who watched this Tuesday talk, this guest expert talk. And what is that and how can they find you?
Excellent. So thank you so much for having us, Coach Rose. Super fun. And again, we do workshops all around town. We also do virtual ones too. So this was just our Adore Your Pelvic Floor, which is just a general overview of what the pelvic floor is. It's kind of like a pelvic floor 101 in our eyes. But we have lots of other ones topics wise if you're interested. And if anybody is in a group or a setting where they want us to come and chat, we are always love to come chat, and we love educating and we love learning as well. So anything that we can be of service, we'd love to do that as well. But to talk about how you can find us, again, our clinic's White Wong PT. We have 2.5 locations, I'd say, because we rent one day up on Craig and 95. We also have one in Summerlin and the southwest part of town. If you have questions, concerns, you can email info@whitewongpt.com. And our phone number is 702-389-1950. But we also want to offer anyone who comes and attends a seminar, we always offer half off because you hang out with us and you've got get a really thorough understanding of the basics. And it's typically easier for us after somebody comes to one of our sessions is that we can really dive in to what we really want to do is treat you. So after you have a better understanding of the educational piece, we do a ton of education in our sessions. That's where we really make sure that we're going through the entire treatment for you.
Well, that's amazing and very generous. And I can attest to Dr. Antoinette's very thorough, and it's a long appointment, and she wants to make sure that she can help you the best way that you can. And so having that 50% off first appointment is like very, very generous of your time and expertise. And I know that the reason I wanted you guys in here is because I know that there are so many women that can use your help, and especially in this group, and clients of mine who have also mentioned to me that they're struggling with certain things, and I wanted them to meet you guys and know more about your service, and also follow them on Instagram. And is your Instagram is just White Wong PT?
Yep, that's it. Facebook and Instagram, and we have a YouTube page as well.
Cool. Awesome. Well, thank you so much. If you guys want to take them up on this offer, please comment on this video below, or you can contact them with any of the information that Dr. Erica just mentioned. But if you comment here or send me an instant message, I'll make sure to connect you guys to make sure you can take advantage of this offer, because this offer is only good within the first week of this presentation. So don't wait, make your appointment, get into contact with them if this is something that you want to not have to struggle with. And like you guys were saying, it's common, but not normal. So it is not normal. And like I mentioned in the beginning, like we could joke about it all day long, but it's not something that you have to suffer through. Somebody says, I'll definitely contact them. It's a great offer. Good. You won't regret it. It's going to be very informative. Oh, that's Sandy. I had to go on my phone to see who it was. So yeah, Sandy, I'll make sure that you get in touch with them and give you their information. Sandy trains with me privately, so I'll make sure that you guys connect. But thank you so much for so generously coming in our group and sharing this information with us. And I hope you guys have a fantastic week. Thanks, Rose. Thank you guys so much for watching. And if you're watching the replay, I would love to know what your biggest takeaway was. And if you're watching live, thank you for participating. Thank you for your questions and saying hi. I know we had Brittany, Sandy, Petrania, Christina popped in. Haley, we had a few people pop in and out. So if I didn't say your name, it's just because it went so quickly. But thank you so much for watching and saying hi. And if you thought of anything after watching this and you had questions, feel free to still comment on this video and I'll make sure to connect you guys. And Erica, I think, is in the group as well. So you'll be able to answer those questions as you see them. So thank you guys for watching. And next Tuesday, we're going to be at our regular time, which is our Tuesday at 2 p.m. for our next Tuesday talk. Haven't come up with the topic yet, so you guys should send me some questions on what you want to hear. Or, you know, I know a whole bunch of you guys have been texting me stuff lately, so I can pull from there. But if there's something that you want me to cover next week or the next couple of weeks, let me know, because every Tuesday I'm in here serving you guys the information that you want to help reach your goals. So until next time, this is Coach Rose, Dr. Erica, Dr. Antoinette, rooting for you to try something new in 2022. Have a good night. Bye-bye.